Oxygenation, inspiratory time affects oxygenation, and oxygen affects oxygenation.
What about,
And go again with the...
And then frequency is your rate, which is going to affect your minute ventilation, which will affect blowing off your CO2, right? And then inspiratory pressure is going to affect your tidal volume, which can also affect your minute ventilation. So you could do a combo of these two to increase or decrease minute ventilation, depending on what direction you need to go with your ABG.
Would you prefer increased frequency?
Yes.
Okay.
If you had, that's why your first goal is to get an adequate tidal volume. And then if my gases are still acidic, and say your tidal volume should be 450, I'm hitting 450 to 500, why would I want to increase that tidal volume on you?
So we can get adequate oxygenation.
Well, I wouldn't want to do that to you, because increase in pressure is going to increase in barotrauma, so scarring to your lungs. So I wasn't trying to like put you on the spot, but I guess I'm thinking like, you know, once you get an adequate volume, you want to do rates. You want to increase rate to blow off CO2. Once you get an adequate volume, unless you're going to be in those scenarios where you might be maxing out both, because I might have a rate of 30 and I still can't get my CO2 to blow off, so I'm going to get bigger volumes to help blow it off. And it's just the scenario you're with, and that's going to come in time. But usually if you get an adequate tidal volume, you increase rate, because I want to do less damage to your lungs. So the way I can do that and protect your lungs is stay with a smaller volume and increase my rate for you to blow off your CO2.
Okay.
Does that make sense? So you want to do less damage. You want to try to do less damage to your patient.
So increase frequency to get good.
To blow off ventilation. So no, these three do oxygen. These two are going to help with ventilation.
So if you have a low compliant lung, would you then have to
I might have to
do more pressure as opposed to frequency?
Yeah, I may have no choice but to go up on my pressure, try to still get an adequate volume, which I know then what their lungs are probably
or
like.
Would you have to drive them both up?
I might be driving both.
Okay.
And sometimes you're like playing with both.